But now it's time to talk to a couple of lovely ladies. We've had Kath back in again today. Now you'll remember her from GAIN. Now GAIN stands for Gynaecological Awareness Information Network. And today we've got Dr. Rosey McKenzie with us as well. Thank you ladies for coming in and welcome.
My pleasure.
Hello.
Thank you, Dr. Rosey. Now, the reason that we've got you back in today is because this is a very important subject.
Absolutely,
Kath,
yes.
tell me about GAIN.
GAIN is it's a support net for work for women and also information so that we can channel you in an easy process to other organisations, professional organisations. And this is where Rosey and I are working together. We're both health consumers.
And how's it going? How's the actual information and awareness going? Are you getting it out there so people will start to educate about this?
Well, we are, even especially after last time I was here, I was able to send that off to a women's organisation on the East Coast, and now they have decided at their executive meeting to do a national gynaecological
well, that's fantastic
project.
News.
So it's wonderful.
Because it is something that sort of people cringe when you say the word vagina.
Yes.
And for a man to say vagina on national TV, people either see something sleazy or sinister. But it's just a part of life, part of a body. Just
yeah,
like
but it's a precious part of the body, you know. It's amazing how, you know, sex is so out there, but it's taboo, and it's interesting to see the dynamics of all of this.
Well, let's introduce Dr. Rosey. I'll call you Dr. Rosey. It's a lot easier.
Yeah.
Now, you're a vet, Rosey, aren't you?
I am. I've been a vet for about 24 years now.
Now, you're also a sufferer of, let me get it right, Endometriosis.
Endometriosis, yes.
Tell me what that is, because a lot of people out there don't know what that disease is.
Endometriosis strikes about 10% of women. So in Australia, you're looking at about 1 million women.
How is it caused?
What happens is the lining of the womb actually migrates outside the womb, and it sets up little implantations of tissue around the abdominal and pelvic cavity. And when a woman menstruates each month, those cells actually shed blood, and they cause like a local inflammation.
Is there a cure for this?
Unfortunately, no. There are a lot of treatments that help. Surgery can help, hormone treatment can help. There's a lot of things done laparoscopically now where they do keyhole surgery. A lot of women with endometriosis, unfortunately, do end up having IVF because they have infertility problems.
Can't have children. Tell me your monthly life. What does this cause for you? What problems does it cause? Thankfully,
I'm over it now because I'm of an age where it's not such a huge issue. It tends to affect women between about 15 and 50. When I was a teenager, I had the worst periods ever. I was at home 5 days a month, hot water bottle on my tummy, in a lot of pain. And through my 20s, I had a number of surgeries. I had hormone treatment. I was sort of in and out of hospital as an emergency patient, as a elective patient. I did have a lot of things to deal with at the time.
Did you have a lot of support, Rosey? Was there people that you could go and see and get support, or was it just, I'm sick, I'm going to a doctor, I've got to have this done?
It was pretty poor back then. We're talking about the 80s. Unfortunately, the support for endometriosis sufferers was really not great. I was told by a doctor at the age of 25, if I wanted to have a family, I'd best get on with it. Go for it now. And I was in the middle of vet school. It wasn't really my plan at the time.
So at the moment, now you don't suffer much with the side effects?
I'm fine now, thankfully.
Are you on medication for life? Is that how it works?
Pardon me?
Do you take medication?
I'm not on any medication now. I had quite a lot of medication. I had hormone injections to suppress the periods because, in theory, what happens is it stops those tissues bleeding each month. That did help a lot. I was trying to get pregnant at the time, and they felt that was my best chance of pregnancy.
So how could you, speaking to our viewers and people out there watching this segment, tell me why you think, in your words, why is GAIN so important? Why do we need something like GAIN?
There's a lot of misinformation out there, and I think if women empower themselves and make use of the GAIN network, they can educate themselves as to what's normal and what isn't. Endometriosis sufferers, on average, take 8 years for a diagnosis. A lot of women think painful periods are normal, painful sex is normal.
So it takes them up to 8 years to find out they've got a problem.
That's the average.
Amazing. Amazing.
Why is that, Kath?
I think it's a social stigma to talk about anything gynaecological, and GAIN is not. We are not from an academic perspective, but it's opening up the doors so we can all share with one another, so we can learn and bring in the experts and the women who are suffering with these things, and then we can get more research and funding so that we can try and help prevent some of these things.
I think we spoke about, does the government support GAIN or what you try and put out there in any way?
Yes, the Cancer Council have supported us, and we do have the support of the ambassadors, Lisa Scafidi and Professor
So you've got some good
Ian
people
Fraser.
there supporting.
We've got some great, not a lot of funding behind it, but again, GAIN is still building our bridges and seeking that sort of support.
Is anything coming out from GAIN that you want to promote? Anything fundraising or anything that you're working on at the moment?
Yes, we've got the International Gynaecological Awareness Day, which is happening on the 10th of September. We just encourage other people to take the initiative and celebrate the day in whichever way they can in their own area.
Now, I know you brought in some props today.
I did,
And you said, is it okay for me to bring these on set? And I said, yes, I love the bombonera you brought in, but it's actually not a bombonera. This one here, I'll let Sonia focus on it. What is this?
Well,
What's this a symbol for?
Well, it's actually a vagina. I found that most women didn't know which bit was which, and I thought, how can I devise something so people understand?
Can I just say for those kids watching, not a real vagina, it's a symbol.
Yes,
it's a phallic symbol, I suppose. So what does this mean?
Well, this is where the penis penetrates the vagina, and see, most women think that their vulva is a vagina, when clearly this...
Now, you've got the vulva here.
This is the vulva.
Tell us what a vulva is, because a lot of men don't know what a vulva is, I think.
Well, the vulva is the external genitalia, and the vagina is the internal genitalia. So, but the vulva is where the clitoris is, and I've just got a little diamond in there. I'm not sure whether we can say that.
I hope I'm not doing anything bad by touching it. I see a few people in the studio laughing.
But I mean, a lot of people think they're women. Sorry, a lot of women think the clitoris is in the vagina, when clearly, when you look at that you know, the two are different.
There you go. There's confusion even amongst women.
Exactly, but we've got the cervix as well, which the cervix and the uterus.
Hang on, I'll get that one out. Oh, I've got to hold this up the right way.
Round this way, that's right. So I had to just sort of come up with a creative idea.
So what is this?
Well, this is the uterus, where the...
Okay, the uterus is down the bottom?
That's right, and
and what happens in the uterus, to educate some of our male viewers?
Do you want to take that one over?
Dr. Rosey?
The uterus is where pregnancy would be carried, and each month the lining of the uterus or the womb is sloughed off in the menstruation. And that's where endometriosis comes into play.
These are the ovaries, yes. And this is the cervix down the bottom, where they take the pap smears. Down the bottom, down this. And that's where they take the pap smear. So I just thought we'd be creative in trying to put a bit of colour and life into gynaecology.
It's actually tremendous, the work that you guys do. It is a subject that needs to be opened up. It needs to be, I mean, pardon the pun, but it's one of those things where I think you can have a bit of laugh, fun, and don't make it so serious, because not only for women, but for men too, because partners need to support their wives and partners and girlfriends or whatever, even just friendship. It's good to have it as an open discussion rather than a topic where people are frightened to talk about it, because it's the personal parts. It's not sleazy what you're doing. You're doing something quite open and honest. Do you think we're going far enough in Australia? Do you think people are starting to open up about GAIN and the stuff that you do?
Well, I think they are, because I'm pleased to say the Australian and New Zealand women's hospitals have endorsed the Gynaecological Awareness Day, but we still need to drive that to make it happen and bring it out and bring the colour and life to it. So that's fantastic, and we have a letter from the Royal College of Gynaecology and Obstetrics, so I don't think we can get much better than that, but we need it on a ground level.
Tell us your website again. Look at that camera there.
Okay.
Tell us the website we need to go into to find out more information.
It's GAIN, GAIN.org.au.
Thank you very much. Now, I do have a little bit of a pamphlet here. When does this come out? Is this like a newsletter?
The Gynemite newsletter is every 3 months we have that.
And where can people get that from?
From the GAIN office, just to get into our website, and we can send you one out.
Thank you very much to Dr. Rosey, and thank you very much to Kath for coming in today from GAIN. We look forward to having you again. Good luck. I hope there is a cure for you. But thank you for coming in and speaking about it today. I know it's sometimes a bit personal, and you've done it very well. And thank you very much to Kath. We'll see you again very soon.
Yes, I look forward to it.